Implants post-op instructions. So you just had your implants placed. First, as we told you before, implants take a while to heal. On average, they take 12 weeks or 3 months if your bone is really healthy, and 16 weeks or 4 months if your bone isn't as strong and takes a little bit longer to heal, or it was more of an intense surgery that we needed to do. But we'll tell you after the surgery. So the first thing is bleeding. Hopefully you have no bleeding right now, but if you do, we gave you some extra gauze which you can use to put and bite on for 15 to 20 minutes. And then you take it out and the bleeding should be good. You gotta be careful to aggravate it, because once there's a clot, if you hit it, you could cause the bleeding to happen again. So try to stay off the area for a little bit. Number 2 is swelling. You are going to get some swelling, but what you can do to help yourself to not have so much swelling is, as soon as you can, get some ice. Put it on for about 10 minutes and then take it off for 10 minutes. And the ice should help make it so you don't have as much swelling. But only do this for the first 24 hours. After that, you don't need to ice anymore. Medications. It's really important that you take the antibiotic if we prescribed you an antibiotic. Pain medicine is really on you. We always recommend definitely take the pain medicine right at the beginning, because pain medicine sometimes take 30 minutes to kick in, and the last thing you want to have happen is have a bunch of pain and wait 30 minutes for the pain medicine to kick in. So we definitely recommend taking pain medicine at the beginning, and if you feel it's not too bad, then you don't really have to continue it. That's on you. Diet. Make sure you don't use a straw. A straw can affect the implant, can affect the blood clot. Just don't do it. Any sucking or spitting pressure. That's also, if you feel you have a lot of blood in your mouth, make sure not to spit. You can swallow it, you can drool it, but you don't want the pressures in and out. That can affect the entire healing process. You want to eat soft foods and you want to eat cold foods. A great example is ice cream. You can also do yogurt, smoothies without a straw, cottage cheese, milkshake, jello. And you know, the biggest thing is just try not biting where the implant was. Try to bite in other areas. If you had all your teeth taken out, and doing a full mouth reconstruction or an all-on-4, you know, then just try to be as careful as you can be. Also, avoid spicy foods for 1 week. Rinses. Do not use any mouthwash for the first day. After about 24 hours, we recommend chlorhexidine, which is a bottle that we will prescribe you here at the office. Smoking. Please refrain from smoking. We have, I would say, 80%, 90% of our complications is due to smoking. We need you to not smoke for the first 5 days. The tobacco just completely interferes with the blood clotting, with the healing process, and causes us a lot of complications. Activities. Avoid any strenuous activities, lifting, running, or any similar activities for the first week. Alcohol and carbonated drinks. Avoid alcohol, avoid carbonated drinks for the first week. Rest. Make sure you get plenty of rest. And for the first 3 nights, try to keep your head elevated when you sleep. Pain. Pain can vary a lot, and it also varies depending on how you do the ones above. So if you take really proper care of your implants, you're probably going to heal pretty easily and be pretty nice. If you do things like smoking, strenuous activities, things like that, that can cause the implants to fail, and then they're going to hurt quite a bit. So it really depends on how the implants do and how much pain you're going to have. Going back to work, well, this depends on you. Most people are going to take about 2 to 3 days off. We have some people that will take the whole week off. And then we also have some people that will literally go to work the same day that they had their implants placed. So it's all over the place. That's really on you when you want to go back to work, but just know most people, it's 2 to 3 days after their implants. Sutures. If you had sutures placed here at the Smile Mission, that means you had a much larger surgery than we typically do, which means if you had a larger surgery, you're going to have a lot more healing, and it might be a little bit more sore for a little bit longer. The sutures we use most of the time reabsorb, and we'll tell you at the appointment, which means in 1 to 2 weeks they'll dissolve. If they don't, you can come back and we can cut the sutures for you. But just know, if you have sutures, all the instruction we're saying is that much more serious for you because you've had a larger procedure. And like always, don't hesitate to call us, email us, write to us on social media if you have any questions, and we have a lot more instructions about our post-op instructions on our website, so feel free to check that out.